So let's talk about Takayasu arteritis. So Takayasu arteritis, it is a chronic granulomatous inflammatory disorder involving medium and large arteries. And, inflammation of these arteries lead to narrowing or aneurysmal dilation, leading to symptoms. And so this is a chronic granulomatous inflammation. And so imagine if if the arterial wall is inflamed, that inflammation can lead to fibrosis eventually, and that fibrosis can cause narrowing of the vessel lumen. And the arterial lumen, when it is narrowed, it can cause ischemia and it can lead to symptoms. It depends on the type of artery that is involved. But at the same time, the inflammation can also cause a weakening of the wall of the arteries. And that weakening of the wall of the artery can actually cause dilation of that involved region of the artery. And that results in aneurysm formation, which can later rupture. And so there are common arteries that are involved in this Takayasu arteritis include a renal artery and the carotid arteries and the subclavian arteries. And so, and here I've put an image of a heart just to indicate that the major vessels that arise right from the aorta. So these are majorly affected, like the subclavian arteries and the carotid arteries. And remember that it is also called pulseless disease, and it's usually late presentation, like when it is pulseless, when there is decreased pulses in Takayasu arteritis, that actually indicates that the disease is really advanced. There is like significant narrowing of the arteries because of the inflammation and fibrosis. So let's talk about risk factors. So the risk factors, like majority of the patients are females, like it's a ratio of 9 to 1, and age usually young, so really young female, like 30, 40, and 50. So these are the major ages. It can also be at 20. So, but just remember that it will be young. And usually ethnicities involved, like Asian and Mexicans, are majorly affected, like most commonly affected. So then coming down to the pathophysiology, so it's a, like we talked about, is a granulomatous inflammation of the medium and large arteries. And inflammation, like I said, it can lead to fibrosis and causing stenosis of the involved arteries. Inflammation can also cause weakening of the arterial wall, leading to a dilation called aneurysm, which can lead to rupture. And so, if you see on a microscopy, you will actually see you may see a lot of like CD4 and CD8 cells, because these cells, these are the type of cells that are involved in granulomas. Remember that this is just like the pathophysiology is just suggested, like these are just suggestive mechanisms. The main etiology is actually unknown, and that is the reason that there is no cure for this condition. And so, but you can say autoimmune has a role, and there is a granulomatous inflammation. We know at least this far. There is the vasculitis. It's an inflammation of the medium and large arteries. So coming to the sign and symptoms, so this is a really significant part of this disorder, because usually it's really hard to kind of diagnose it just directly. Like there is no specific finding that you can just directly say that this is Takayasu arteritis. So it's a really diagnostic challenge for a lot of the physicians. And so, but what we can do here is that we can say that first, we can like take detailed history. Like this is a really like detailed history and physical examination, like meticulous physical examination is a really important aspect of the management of this disorder and the diagnosis of this disorder. And so the initial symptoms are non-specific, so it can involve fever and it can involve anorexia and weight loss, and these are really non-specific, so because a lot of things can cause this, so it's not really helpful. The specific signs and symptoms that we often kind of like make us think about the possibility of Takayasu arteritis occur actually later in life, like when the disease have actually really progressed. It has become like pulseless, and their arterial insufficiency has occurred. And so once that occurred, like we talked about previously, that the common arteries include the renal. So when the renal artery is blocked or stenosed, we know that it can result in hypertension, because it can result in activation of the ROS system, renin-angiotensin aldosterone system, which can cause hypertension, just like in atherosclerosis, right, where the renal arteries are stenosed, and then it can cause ROS system activation and hypertension. And obviously, when there is stenosis, it can result in abdominal bruit. So on a stethoscope, you put a stethoscope over the renal area of the abdomen, and you can hear a bruit. And then carotid stenosis, when that happens, it can result in neurologic signs. So it depends on which part is most affected, which part of the heart can cause muscle paralysis, it can cause vision loss, it can cause a lot of the abnormalities, meiosis, what is it, the Horner syndrome. So all of these findings, it depends. Like the neurologic findings like vary, but remember, if carotid artery is involved, it can result in neurologic signs, and carotid bruit, obviously, because it is stenosed. And so that subclavian artery subclavian stenosis can also occur. Like this is the third one of the common arteries. Like these three arteries are commonly involved. So subclavian artery, when it is stenosed, can result in upper limb claudication and also the absent pulses in the upper extremities. Those things. So it can result in accelerated atherosclerosis and heart failure in later life as well. So this is also one thing to be aware of. So the management, like I said, there is actually no cure for this condition, but there are some management strategies that we can use. For example, medical management, usually very ineffective, but we can use glucocorticoids, and immunosuppressants that have also been used. The immunosuppressants commonly used, other immunosuppressants apart from glucocorticoids include anti-TNF and tocilizumab. Tocilizumab, remember, is it is interleukin 6. So that's important medication to be aware of here. And so then this, but the mainstay here we can say is surgical. Like right now, previously people would do the medical treatment a lot, but right now surgical revascularization has become like more common. But remember, even after revascularization, there is a high failure rate, so you may need revascularization later in life as well. So it's really a chronic condition that you have to manage chronically. So it's really hard to treat. And one thing in the diagnostic session, in the diagnostics that I forgot in the science in the diagnostic is that the main imaging modality we have is the CTA. CT angiography can be used, and our CT arteriography, or we can also use MRA. MRA or MRI. So these are the major modalities we have in order to diagnose Takayasu arteritis. So hope this this presentation was helpful.